Welcome to Research Renaissance, presented by the Karen Toffler Charitable Trust. Embark on a journey into the forefront of cutting-edge brain science as we feature insightful discussions with a diverse array of guests, from early career researchers pioneering groundbreaking science to influential voices in investment communities, policymaking, and research institutions. Together, we delve into neurological diseases, their causes, treatments, and the quest for cures. Join us in advancing our understanding of the brain and addressing its ailments. Welcome to Research Renaissance. I'm Deborah Westphal, your host and guide through the fascinating future of the brain. Joining me today is Anne Woodbury, founder and CEO of Cura Strategies, a healthcare communication and public affairs agency. Today, we will be discussing the importance of open strategic communications in healthcare. So let's dive in. Welcome, Anne.
Hi, Deborah. Thanks for having me.
I've been looking forward to this discussion. You've got an incredible, career, and your experiences are very wide and vast here. And I'm really looking forward to this discussion.
Thank you. Me too.
Yeah. So let's just start with, in 2016, you created Cura Strategies. Tell us about what that is and what motivated you.
Sure. Well, I've always had an entrepreneurial spirit. My dad was an entrepreneur. He owned a small business, and, owning a small company was kind of always a goal. I wasn't sure how it was going to happen, but things just came together in 2016 for it to happen. And I started Cura. Cura is a Latin word for to care for or to heal, which I thought represented really well what we were trying to do with the healthcare system, which was really to heal and to transform the healthcare system. At the time, I had experience. I'd worked for 12 years for a member of Congress on Capitol Hill and at a think tank, and we wrote a book together. And then I worked for about 10 years for a publicly traded company, and I was leading an office there that focused on healthcare. And, publicly traded companies are just different than, private owned small businesses. And although my division was doing really well, some of the other areas weren't. And so at the time, I just kind of was over robbing Peter to pay Paul, having money and creating creating profits that would then go to other folks and not able to really reward my team. And I also just really wanted to focus on healthcare alone and clients that wanted to be change makers. And so we started Cura with that vision to transform healthcare, to work with nonprofits and for-profit companies that wanted to do big things in healthcare and to help stop injustice, stop medical errors, increase quality, increase access. Those are the things that really drive us and why we created Cura.
So you're kind of at the nexus, or you've been at the nexus of policy and healthcare. Why healthcare and why policy?
Yeah, well, I think it really came naturally. I found out really early on. I was a human development and family studies major in college, and I took my first counseling class and social work type class. And I realized that helping people on an individual one-on-one level was really not for me. I really liked the systemic nature of policy, and ended up, interning for my congressman, and that really catapulted a career in public affairs. And I loved it. I love the focus of it, the camaraderie of it, the mission type work. And healthcare is so personal. It's so important to our country. I wouldn't get excited about necessarily marketing, a product like toothpaste, for example. It has a role, but that just wasn't for me. I really wanted to focus on healthcare. And, my parents were aging, and I was seeing more and more the challenges in the healthcare system. And when I was given the opportunity to really focus my career in healthcare about 4 years into my professional career, I jumped at it. I mean, I was scared. I think it's very complex. The more I know, the more I realize I don't know, particularly around healthcare policy. But I think it's important to keep focused on, what the goal is of healthcare and serving patients. And, if you have that North Star in mind, then the policy and the other types of actions that you can take to improve it, they'll come naturally, and you'll know what to do.
So Cura Strategies, I think you define it as a strategic communication and kind of an advocacy company. For those that may not know what that means, what specifically does it do? Because you mentioned it's there to help patients and it's there to help people. What is strategic communications and advocacy?
Well, it's funny because when I got a job at a communications agency after 12 years of working for a member of Congress in those different capacities, I had no idea that there actually was an industry of, public relations. And here I am now, 20 years later, owning a company. It is a little amorphous, but really what it is, it's about advocating for ideas. It's about changing behavior. It's using strategic communications, which is really earned media, media relations, social media, websites, digital, any kind of messaging, branding, all of that would be considered part of strategic communications. And then, of course, on the policy side, there's public and private policy, but our focus is more on the public policy that the government makes. And the nexus between the two is a specialty of Cura. I spent, as I mentioned, the 12 years on the policy side, and then most of my work in the strategic comm space before Cura, I would say the majority of it was more about corporate communications. It was about, advocating for a product. And I would be in these meetings with, corporations talking about how they wanted to be thought leaders on certain things. And I said, does anybody talk to the government relations team to figure out, what can we do to shape the market? What can we do to help improve the constituencies that we're trying to serve through policy change? And, I realized that not a lot of people on the corporate communication side really had a policy background. On the same note, folks that are in GR or government relations that are trying, up on Capitol Hill doing like the shoe leather lobbying didn't really have a full picture of all the tools in their toolbox that they could use to shape the conversation and shape the environment. And so Cura sits at that nexus, and that's a big part of what we do. We work with nonprofit groups like trade associations, hospitals, patient advocacy groups, pharma companies, device companies, et cetera, to help them advance an issue, whether that be a policy issue or behavior change, et cetera.
Can you expand on that a little bit more? Because that's really important, but some people might hear that and think it's more, I'll use the term manipulative. What I hear you saying and what I'm aware is really education. It's broadening the debate. It's really trying to get deep into the pluses and the minuses or all aspects. Am I off base here?
No, absolutely. You're absolutely right. I think there's Hollywood hasn't done us any favors when it comes to people thinking about how policy is made. And it really is about education and about data and evidence and personal anecdotes and stories, personal experience coming to that. But absolutely, it is about educating the people that are in power, that have the authority to make change. They're not experts in what we're experts on. Most of them aren't. And so they really do need the expertise of the electorate to help educate them. And I think that's really what we're trying to do, is make better policies and educate policymakers on the real life experiences and the evidence that we know from the everyday.
Yeah, and healthcare is so complicated, as you said, that it does take that, education. It does take those different perspectives and kind of laying that out so that good policy can be made. Does Cura, do they choose which campaigns or that you engage in, or how do you, decide where your energy is going to go?
Sure. We're a for-profit company, so the clients usually come to us with an idea, and we have a framework that we use to decide what clients that we're going to take and not take. And typically, if they are going to advance quality, advance access, hasten innovation adoption, such as research, et cetera, those are the clients that really get us excited and get us up in the morning and excited to come to work. If somebody is really interested in, protecting their own fiefdom or their own position, like that's not the kind of work that we do. There are plenty of agencies out there that don't have the same type of criteria that we do, but ours is very mission focused. It needs to advance in a positive way the patient experience, healthcare outcomes, healthcare quality, healthcare justice, those types of things.
So can you discuss what Cura Cares program, what is that program, and just really the impact of overall health?
Sure. So this is our charitable arm of our company. We've had it since the very beginning. Every day we're working with clients and influencing things on a more systemic level. But I do think, the shaping the policy, the educating, it's all very important. But Cura Cares helps us stay grounded to the patients and helps us get to, see at a very ground level the real impact that it's having on people's health, of these changes that we're trying to make. So on a quarterly basis, we do something. We either, could be packing lunches for people who are food insecure with the DC Central Kitchen, or working with teen moms and their babies through Young Lives, or supporting the Juneteenth Foundation, which we've done for the last 4 years to celebrate America's second Independence Day. These are all things that keep us close to the community, keep us close to the issues that are affecting the people that we're trying to help. And I think it's an important part of what makes Cura a great place to work. I think people really like that. And it also helps bond us together when we're doing something that is really giving ourselves through others. So it's both in our time and action, but it's also financial.
Yeah, it seems like it really gives that balance, right, from your clients, but yet it really your workforce and what you guys care about and spending your time with. You also, from the discussions that you and I had early, and then just some of the information I can glean, you really kind of pointed inward too, to the wellness of your employees. And it's not just outside your organization, but it's also inside your organization. And I think you're a very big advocate for mental health. And so can you talk a little bit about that, both what you do inside your company as well as, outside?
You bet. I mean, mental health is a huge focus for us. We have done a lot of work in this space. Former member Patrick Kennedy has been a longtime client partner of ours, working with the Kennedy Forum. And I've really learned a lot about the importance of mental health. I firmly believe that we can't separate physical health and mental health. It's totally acceptable to take PTO when we have a cold or we need to go to the dentist, but it really needs to be acceptable when we need to take a mental health break or go to our counseling session. And I think my team is pretty transparent about that, about when that is needed, and we respect that about one another. We just need to normalize, talking about mental health and being open about why it's important. I think more employers can lead the way when we accept that our employees aren't robots, that they have these mental health needs. We do things in addition to things like flexible work hours and hybrid work and our Cura Cares program, which are some of the things that I think contribute to the mental health. We also have special speakers. For example, during National Mental Health Day, we had Elizabeth Miller, who has a podcast called The Happy Healthy Caregiver. She came and spoke to our employees about self-care. She focuses on self-care for caregivers and the idea of micro-dosing self-care, that, it's not really about having necessarily like a whole day set aside, but it's more about, where can you still 5 minutes in your day to do something that is going to refresh you. And I think it was a really helpful concept that we then became part of our vernacular in the company. So that's a big part of it. I think the other thing that is interesting that I feel like gets lost, and I'm trying to find ways to, infuse this concept, particularly in the younger generations, but work itself is good for mental health. I mean, I think that there is purpose in work. The McKinsey podcast I listen to occasionally, and they had a study they were talking about where they found in their research that 70% of people say that they define their purpose through their work. And I think it's so important for people to see that there isn't always a difference between your personal life and your professional life. I mean, of course, there's different norms that have to be respected, but in general, in terms of finding purpose, I think work provides that. And I try hard to do that at Cura. Sometimes when we talk about, what did you do today or what are you doing today? And people say, oh, I'm writing a press release, or, I'm staffing a media room at the American College of Cardiology. I'm like, no, you're not. You're helping improve outcomes for people with chronic kidney disease by writing that press release. Or, when you're at the American College of Cardiology and you're helping, their team staff the media room, you're helping hasten innovations quicker to get to the front lines of medicine by making sure that reporters know about the innovations that are being talked about at the medical meeting. So I try to always make it, bring it down to how is our work impacting patients at the end of the day.
Yeah, that really drives purpose. It's not just the actions that you're going through to fulfill the job description. It's, it really is that purpose and passion. So with you being in it's kind of the policy and that communications, that strategic communications, how have you seen health, the awareness of mental health change over the last, say, 10, 15 years? Because I just think it's either I'm more aware of it or there's just been more awareness of it. We just saw Simone Biles, back at the Olympics. It was really a controversy last time, when she said she needed to take a break because of her mental health. But it just seems to be that it's more of an acceptance now. Have you seen a lot more awareness? And does that feel pretty satisfying, with some of the work that you've been doing?
Absolutely. I mean, I think about one of the projects that we did. We started a coalition with Patrick Kennedy called Mental Health for Us during the 2020 election cycle, where we were trying to elevate mental health and addiction on the national agenda. And we had 96 different organizations join on to this platform, policy platform of how to advance mental health. And it's really interesting to see how different presidential candidates, we were focused on the presidential race at the time, were talking about mental health and the need to address mental health. And of course, as you know, we had COVID happen. And I think that probably did about as much as any kind of public affairs campaign, if not more, to focus on the importance of mental health and socialization. And now you have, the Surgeon General has come out and talked about the importance of connection and mental health, and that we have a mental health crisis, particularly among our younger generations. I think that it's getting more attention by policymakers. I think that's really smart, and I think it's going to help us as a country. I think it's important to have a good mental health workforce to stay secure, to stay entrepreneurial, to stay in the competitive position that we are. And I think more people are starting to see that it's not fluffy. I mean, it's really important. It's about the health of our nation, really. And I think people are starting to realize that.
Yeah, and that's a good thing. So you talked about DC, and you spent a lot of time in DC, I'm sure. What is that DC culture, especially when it comes to policy making or advocacy? What is it that makes it kind of unique or challenging, or however you want to describe it?
Well, I think it's interesting. When I talk to healthcare people, there's such a culture in healthcare among doctors and nurses, hospitals, but also in research. There's a whole culture. There's a nomenclature. There's norms, and DC is the same. Has its own little microcosm. We often say that DC is like living in a small town. It's very interconnected, and I think it's important for people who want to help educate policymakers and get something done in Washington to understand how it works. It can be everything from a big thing to a little thing. In fact, we've spent a lot of time focused on how to train people to integrate and infuse their ideas into the DC culture. We actually created a online course called Advocacy Academy. Your listeners can go and take it for free at advocacyacademy.org. It is a 60-minute, 9-lesson course on what is advocacy, how to do it, how to get a meeting with a member, what to do in that meeting, how to tell your story. Those types of things are really important. Some of the things that it doesn't really cover, though, are things like, for example, if you're going to come to DC, you don't want to come on a Monday or a Friday. You might think it makes sense because then you could spend a nice weekend visiting the monuments. But, the reality of it is, members are usually at home during those times. So, you don't ever want to schedule an event on a Monday or a Friday, or you go in and you think you're going to be talking to, somebody that is very seasoned and has a lot of expertise in a certain area. But what you're really doing is sitting across from a 24-year-old legislative assistant who has, 4 or 5 different issues. They could be covering healthcare, education, national security. And so, and you may think to dismiss that, but the reality of it is those young people have a lot of power. I mean, the members really rely on them to brief them on the issues and to, guide them really based on their own philosophical beliefs, to tell them certain things and to guide them in certain ways. And so you never want to dismiss anybody that you're meeting with. There's a tremendous amount of power in each of those positions. I mean, those are just some of the things that I think about. I think there's also the idea of like when you're going into a Hill meeting, for example, I sometimes, it takes a long time to get the conversation going. And I always try to counsel my clients that this is not really a conversation. This is an education. Like, don't be afraid to have a parachute start, just to jump right into it and get out what you need, because you never know when that bell's going to go off and the member's going to have to leave or go to another meeting. You need to be very succinct and, what you tell them, and you need to have a call to action. That's something that I learned when I worked with former Speaker of the House, Newt Gingrich. He came out of a meeting one day and he was just shaking his head. And I said, what was that all about? He said, well, these people that came in, they had a big problem. I don't even remember what the issue was. And they basically spent 30 minutes telling me all about the problem, but they didn't tell me at all about how to solve it. And now I'm going, to another meeting, and I'm going to have another 8 meetings of people that also have problems. You can't expect policymakers to create the solution. And so he said, you always got to have an ask. They need to come with the solution. And I think that's really important to make sure that you, at the end of the meeting, that you have that ask. So there's some kind of tricks and tips that I think, having somebody who has some experience in the space, can really help make those interactions much more effective.
Yeah, you mentioned researchers, and the Karen Toffler Charitable Trust funds, early career researchers that do advanced research that probably doesn't get on the radar too much from NIH or from, some of the institutions, the funding institutions, because it's much higher risk. However, it may be the breakthroughs that we need. And, it seems to be a very, and this is not in a derogatory way, but a very passive kind of grant giving. Okay, this is what NIH has asked for. This is what we're going to, rather than those bold kind of ideas. And so your encouragement for them, to these researchers or these research leads, to reach out and start, asking and telling their story is, I think, one of an encouragement. How would they go about doing that, though? Because that's not kind of typical. The institutions are not wired this way. Is that even a possibility for us to be more aggressive in talking about some of these advanced research in technologies to really change healthcare?
Absolutely. Absolutely. I think it was Thomas Jefferson. He has a quote, something to the effect of, government is not necessarily for the people. It's for the people who participate. So you really need to, the first place to start is your own member of Congress. And you don't even have to come to DC to do that. You can go to one of their congressional offices in the district and get to know the legislative staffer that is covering healthcare research and explain to them the work that they're doing. They may not know that, this work is being done in their backyard, and they become a champion for that. I have one story that makes me think of is, I think a lot of your audiences knows how much money comes from the government, right? NIH, NSF, DOD, they all have research programs that are really important. And it's important for people to, they can direct money into specific disease areas. We had a client in the rare kidney disease space that had money set aside for them in the congressionally directed clinical research program at the DoD. And they had gotten a few $1,000,000 every year in report language for their disease area. One year they didn't, I don't know exactly what happened. From my understanding, I think their GR person left. They just didn't request the money and they didn't get any money. They started working with Cura, and we were able to explain in a way that the member understood about the importance of the research that was being done for this rare kidney disease. And they ended up getting 4 times more money than they had ever gotten. And over the last 4 years, they've gotten $50 million in grant money for the research for this rare kidney disease. I think that's a really good example of, you don't get what you don't ask for. And in DC, there's a saying that if you're not at the table, you're on the menu. And in this case, that was the case. Like if you don't ask for it, if you don't tell them what needs to happen and why it needs to happen, then you're not going to necessarily get that money. Now, places like NIH, some of those bigger appropriations bills, they don't like to necessarily do set asides for specific disease areas. But that's where, when you have somebody who has worked on Capitol Hill, they understand, how to make it happen in a way that is not so direct. So there's something called committee report language that can also be very influential, particularly in agencies like DOD, where they really take that as almost legislative law and will direct that. And that's really where we've been able to be successful in getting some research dollars set aside for specific disease areas.
Yeah, I think that's really important because, we all know the diseases that get a lot of attention, but there's a lot of people out there that, they may be one of 200 people that have this disease. And, I think what we're finding though is they may have that disease, but the information and the knowledge that we gain by studying that disease will lead us to maybe breakthroughs in other diseases. And there's a lot of benefit in not only those 200 people, but just the knowledge gain for a much bigger group of individuals that may suffer. So I appreciate you going through that. I think one of the things that I'm really curious about is trust. We hear a lot of, chatter, concern, judgment around, trusting the government, trusting who's, which side, whatever it might, you might take. But, is there, in your opinion, is there kind of a trust deficit between the public and the government or business institutions? And, especially when it comes to healthcare. And if there is, what do we do about it?
Well, that is a very big question. I absolutely believe that there is a trust deficit. And I think research really shows that there is increasing distrust from media, from government, from large government agencies, and from corporations. I was looking at the Edelman Trust Barometer. They've done great research on this topic for a really long time. And actually, CEOs talking about their own companies are pretty highly trusted, which I thought was really just an interesting anecdote. At the same time that government agencies are going down, and I think COVID and there's no secret about the criticism that the CDC has gotten about, how slow they were to respond and the inconsistencies in some of the messaging. And I think that there really needs to be a hard look at the public health infrastructure, and how much we are underinvesting in that in terms of being able to be prepared for the next epidemic, for example, and getting information out and having more structured processes about, when we're going to notify the public. But I think beyond just the agency side, on a more, I guess, systemic side too, I think that it starts with people understanding more about really companies being more transparent. And I think this is very important in healthcare. Transparency has not been one of the big principles that healthcare has really driven the marketplace. And I one of the podcasts I listen to is from Kaiser Health News. It's What the Health. It's an interesting name, but it's a great podcast to kind of get you up on what's happening on policy this week. And it's taken, the guests are reporters from different healthcare policy, and they do a feature every week called the Bill of the Week in coordination with NPR. And they always have a story that just really brings to life how bad it is when you have a situation where, the latest one was this man went to an urgent care emergency center. That's what it was called. And he thought he was going to an urgent care center. And he was ended up being charged like he went to an emergency room. And he purposely did not go to an emergency room. He thought he went to an urgent care center. So he was charged a $500 copay instead of a $50 copay. That type of really shenanigans is just not, doesn't help the issue of trust at all, especially among the medical system and among policymakers, when you just cannot understand what the cost is of healthcare. I think that, if we were to focus more on transparency and things like cost and things like outcomes, for example, and we've come a long way, but I do feel from a healthcare perspective, that would really benefit us.
Yeah, I agree. Just having gone through something very similar a couple months ago, where it was, here's your total cost, but as soon as the procedure was done, you continue to get, bills that you never expected. So I agree with that. I like the Edelman report also. And you mentioned that, CEOs talking about their company, that trustworthiness is going up. Do you think they're getting more transparent about what they're doing, why they're doing it? Or is there some other reason there that, that trustworthiness is going up?
I think that they have to, because they know that if they don't tell the story, it's going to get out in some other way. With social media now, I mean, there are no secrets. So I think that if people understand that if you want to have the truth out, that you have to be the one to share it. And I know that's one thing, in any kind of crisis situation, or if something happens to one of our clients that, is in a quote unquote crisis or having to do issue management for their company, being transparent and being authentic can go a really long way. Taking it back to medicine for a second, I know that there's research out there that talks about when there's a medical mistake, and the doctors that come to the patients and the families and say, this is what happened, they're much less likely to be litigated against. They are, if people want to be treated in a way that is authentic and real and truthful. And I think if we can, have more of that type of relationship, whether it's with the CEOs or with your doctor, I think we'll start seeing that more, that trust being regained. But we have a lot of work to do, particularly among the policymakers.
Yeah, I think there's, the opioid addiction epidemic. This is another one that is, one can stand back and ask about, truthfulness and transparency and trust. Tell us about the program Not a Pill initiative, and what are those critical needs that you see in addressing this epidemic?
Well, it's another area that we've spent a lot of time and working with through our clients. And right now, as you mentioned, we're working on this program, Not a Pill initiative. First off, stigma is a big one. especially when it comes to recovery treatments. What evidence-based treatment is for opioid addiction, it's different for opioids than it is for other types of addiction. I think in alcoholism, going cold turkey and AA is considered to be kind of the very effective. It's not necessarily the case with people with opioids. People think it's a case of willpower. They don't really understand that there's what's happening in the brain and the addiction, the dependency on this opioid. And so the evidence shows that treatment is most effective when there's medication assisted treatment, which is a kind of a term of art that's more than just recovery medication, but it also includes counseling, therapy, and social supports. And there was a lot of hesitancy particularly among policymakers and insurance companies about paying for medication assisted treatment. 8 years ago or so, even 5 years ago, Medicare and a lot of Medicaids and states did not cover all the recovery medications or medication assisted treatment. And so one of the things we did, again, with Patrick Kennedy and my former boss, Newt Gingrich, as well as civil rights champion Van Jones, we created a coalition called Advocates for Opioid Recovery, and we're able to educate folks about that. I mean, at the time in 2017, we had an HHS secretary that said, recovery medication was just trading one drug for another. I mean, this is our HHS secretary. So the amount of work that we need to do to educate people about medication-assisted treatment it was fast. I think the epidemic and just the human cost of it was forcing more attention on it. And we had, leaders that wanted to focus on it at the time. And we were able to get some legislation passed that now, Medicare is covering opioid treatment programs, for example, and a lot of most Medicaid states, I think, are all covering the three different recovery medications. But program, not a pill, it's almost like the pendulum has swung too far in one way. So there are 3 different recovery medications: buprenorphine, methadone, and naltrexone. And whereas buprenorphine and naltrexone can be purchased or prescribed by a doctor that can prescribe any narcotic, methadone is different. Methadone itself is an opioid. Bup and naltrexone, you cannot overdose on them. There's not the same diversion risks as there are with methadone, which in and of itself is an opioid. So that you have to get an opioid treatment program. Well, there are people that said, okay, well, now you've told us that, recovery medication is really what it's all about. Let's just give them the medication and that should be enough. And you should be able to get that at your normal doctors without having the social supports, the counseling that the evidence showed was medication assisted treatment. And so they basically want to, take a 3-legged stool down to a peg. Well, that's not going to work. And so there's quite an argument right now around that, and quite a discussion, I should say, about people wanting to just, make it all about the drug and not have the other types of social supports that are in there. So Program Not a Pill was designed to basically, educate influencers, thought leaders, that it really is about taking a programmatic approach and looking at what the evidence says and not just about, issuing a pill. And I think that, that's an important distinction and one that we're going to be continuing to talk about what is the best way to treat. There's a lot more research that needs to be done now that people are accepting these recovery medications. What do we need? How do we get these medications into the hands of the people that need them? And a lot of people do already have access to them, but there's more that needs to be done.
I imagine too, it's hard to identify the metrics and the measurements for a long-term kind of view, because taking a program view is more holistic, and it's really about, the end state where somebody ends up healthy, right? Healthy and not addicted. It's much easier to measure how many pills or how many people went into treatment. One of the things that I'm, concerned about, and the Karen Toffler Charitable Trust is concerned about, is this graying wave in the United States and also in many different parts of the world. People are getting older. There's, all sorts of things that come with that. Neurological diseases, assisted living, all of that. But what kind of strategies can be employed at a policy level to prepare for, what some predict. Just take, for instance, Alzheimer's, that we'll have, 50 million people with Alzheimer's or dementia here in the next 10 or 15 years. What can policymakers do to prepare for that?
That's a great question. I think it is a question that's not getting asked enough. I think that we're really late to the game in figuring this out, considering by 2030, 1 in 5 Americans will be age 65 or older and outnumber children for the first time. I mean, AARP outlined a national plan on aging. They just released it, I think, last week. We're a little bit late in really taking this on. I think, caregiving has been one area that's been personal. I've been, personally impacted by, and so I naturally would love to work in the policy space in that area. And it's surprising how little advocacy organizations and how little funding there is to think about this problem. But luckily, there are a few, and one is the West Health Policy Center, who we've been working with for the last several years. And they helped the state of California create a master plan on aging and are championing other states to adopt it. And sometimes it has different names. Could be called a coordinated system of aging, a multi-sector plan on aging. But there are 7 states currently that have these plans in place, and there are 14 others that are developing right now. And really what it does is bring together the stakeholders at the state level to put together a 10-year blueprint for restructuring state and local policies, looking at different levels of system coordination to ensure that the seniors are going to get high quality coordinated care and the support services they need to age in place, to promote healthy aging, independent living. It's really an interesting social project that they have funded and taken on, and I think is really showing in states like California, Pennsylvania, Massachusetts that have these plans are so much better prepared. I mean, we do have a national strategy that was, I think it was in 2018. There was the Raise Family Caregivers Act that looked at caregivers and how they're going to be taking care of their aging parents. And unfortunately, a lot of the provisions in that bill were not actually funded, but eventually it did. And in 2022, they came out with a national strategy that looked at, how can we increase outreach and awareness for family caregivers? How can we help them build partnerships and support systems for one another? How can we ensure equitable care? I think the caregiver burden is going to continue to be a big issue for our economy, for employers. And I don't think that we're totally prepared for that. But at least we have these blueprints in place, and that there are, suggestions, policy suggestions that they have put forward at state, federal, and local levels that can, help prepare the infrastructure to be able to take on this graying wave.
Yeah, I echo your concern that we may be behind the power curve, because the people that are there to take care of the aging may be also the ones that have Alzheimer's or dementia. And if we have such an increase of some of these conditions or these diseases that manifest in that the process of aging, it could be a real burden across so many different industries. And so I echo that. Another thing, and I don't know if you even want to touch it, but it's the idea of ethics. And ethics, when how I'm thinking about it is in technology that might help us with that green wave, or some of the technologies that we're using to understand the brain, or do our research. We see it. Congress has they have discussions around ethical use of AI or social media. Technology is advancing very, very quickly, but our ethical considerations are probably slower. Any thoughts there? I know other people kind of work in that area of ethics and healthcare and technology, but just wondering what your thoughts are.
Well, this is definitely my thoughts, and I don't have a lot of experience in the area specifically. However, when I go back to thinking about some of the things that we've been championing about, like technology and interoperability of medical records, for example, or just use of data, patient data, all of this has been coded at this point. It's in these electronic files, and if we could just somehow figure out how to make them interoperable and mine the data quicker and not have these fiefdoms of medical information, just think about how much quicker we could progress research. That is very exciting to me. Now, on the flip side, we've got privacy challenges, and I think that has kind of kept us from having a lot of more natural interoperability. We have these registries, for example, that are popping up, and there's so many of them. But it takes effort to put information into those registries, and it takes years to get them built. And if we could break down some of the technology silos, I think it could really improve how quickly we can get to some of these discoveries. The ethics is an issue, and I think that for people who want to put their medical information, even if it's de-identified in some way or some unique identifier, I think that could really be something that's worth considering. And I think that people are nervous about that for some of those trust issues we talked about before from the government, and having access to what that unique identifier would be for an individual person. So it's a discussion that's very worthy to have for the benefit of really advancing healthcare discovery, in my opinion.
Yeah, I appreciate you sharing that. I want to go back to several years ago. You wrote, or you co-authored, a book called "Saving Lives and Saving Money," and at the time it was a kind of a blueprint for healthcare reform. Since that book was published, what progress have you seen? And would you write the same book today?
It's funny. I wrote it with Dana Pavey, and it was co-authored with my boss at the time, Newt Gingrich. And it came out, I think it was in 2023. And at the time it came out, Medicare didn't even cover prescription drugs. So a lot has changed since we wrote the book. At the same time, not enough has changed. And I think that is really the challenge that we have in our society. I mean, at the time we were on the dawn of getting people to do e-prescribing, for example. Now we have electronic medical records are the norm, which is fabulous. They're still not interoperable, but there's been a lot of progress. A lot has changed in terms of innovation, genetic medicine, biomarkers. There's so much from a scientific point of view that has improved. One of the things that we talk about in the book, there's actually 12 different principles that we talked about, and one of them is about being outcomes measured, because there was really not a lot of transparency in outcomes at the time. But shortly after the book was published, or maybe it was right around the time the book was published, we had the Leapfrog Group come into existence, which is a group that still exists today, and a group that we work with that is making information about different metrics on hospital care available to the public, that they can search and see what the differences in hospitals, even across the street from each other, have on maternal outcomes or infection rates. So a lot has really happened in the last 20 years to advance some of these ideas. Another idea that we had was about, paying for value instead of paying for process. And value-based purchasing is something that has been advanced by groups like the Purchaser Business Group on Health and the Healthcare Transformation Task Force. These things we're starting to see them become more popular as paying schemes for paying for healthcare, where we're paying for outcomes. But it's hard to measure. We're talking about human life. This isn't exactly an automobile we're talking about. So they have to be risk adjusted. There are things that need to be taken into consideration. It's complex, but I'm pleased to see that some of these ideas have progressed. Another one we talk about is, the name of the book was Saving Lives and Saving Money, Transforming Health and Healthcare. And we talked about having health first and healthcare second. There's been a huge shift, I think, in how we've been paying for preventive care, for example, and how we don't have copays on most preventive services at this point. I think that has gone a long way in helping us focus more on prevention as opposed to just acute care. So those are some very positive things. On the same side, I think, probably the biggest one that is still very complex, I think about, is the price transparency that I think is, we made a little progress in the last few years, but it's still really hard to get information about what the price is on things. And I also think that, I believe in a more of a market-based approach, and that's going to help drive down the costs. I think the costs have gotten so out of control. It was a problem 20 years ago, and it's only becoming more of a problem. I'm acutely aware as a small business owner who pays the premiums for their employees, they're 100% of their premiums. And every year I get that it's going up by 10%. I mean, that is, we've been saying it again, for so many years that it is not sustainable, but yet the costs continue to increase. And I think we've got to figure out how we can continue to increase knowledge, increase the healthcare system to be individually centered and increase outcomes, but not have these huge cost spikes that are really unsustainable. And I think that's what we haven't really reconciled yet, is how do we not ration care? How do we continue to innovate, which, the United States, we really subsidize, particularly in drug development, the rest of the world. And with the prices that we pay, how do we continue to have that type of innovation, but also, not continue to see these huge rising costs? And I think for me, that's about getting back to more of a binary market mediated system instead of, a bigger third party controlled system. And so would I write it again? I think that it would be fun to write the book again and look at, how we would apply these same principles. I think the principles stay. It's just how how much they've been applied.
Yeah, I really appreciate you going through that. And it just, as you were talking, I was just thinking, so many times we think policy gets done very quickly. Policy and, this direction, it takes a long time. It takes a really long time, and it is so complicated. And that may be good too. And because if we were doing everything quickly, it may not be, it may not be as right as what sometimes, things do kind of balance out and get right for most people, I guess.
That's well said.
So as we wrap up here, what is your greatest hope for the future concerning the U.S. healthcare system? We spent a lot of time talking about what it is, what it's been, some of the challenges, but what's your greatest hope?
My greatest hope is, that frankly, that healthcare costs can be stabilized, but innovation and access will not suffer. And that we'll have transparency in cost and quality of healthcare as much as we have in purchasing other products that we buy. Even we figure out how to make it risk adjusted so it's fair to the providers, but that we continue to have the greatest healthcare system in the world, but that it is affordable, for the people that are paying for it. That's really my greatest hope.
Yeah, well, and you're right in the middle of it, trying to make that become a reality. And I appreciate that for sure. Wrapping up here, how do people get in contact with you if they want to talk to you, learn more about Cura Strategies, or just maybe even want to hire your company to help them?
Well, they can always reach out to me on LinkedIn, but if they can go to curastrategies.com and hear more about Cura, and there's contact form there. Or they can also go to advocacyaccelerator.us, which has a lot of our public policy advocacy information on it. There's some webinars there, the online courses there, etc. So I'd love to talk to anybody that's listening that is interested in, what their organization or company can do to help shape the future of healthcare.
And I really appreciate you spending your time today. And I really appreciate what you do and spend most of your energy on. So thank you very much.
Thank you so much, Deborah.
Thank you for joining Research Renaissance. For more information and to stay updated, subscribe for more episodes and visit our website at tofflertrust.org. Feel free to call us if you have any thoughts, suggestions, or just want to find out more about the Karen Toffler Charitable Trust. Until we meet again, onward and upward.